Hey everyone, I'm here to talk about something that's changing the way we diagnose disease, pet-guided biopsy. This is a fascinating advancement in medical technology that's making a real difference for patients and doctors alike. Whether you're curious about how modern medicine works, or you or a loved one might need a biopsy someday, understanding this process can be really helpful. Now, if you've ever heard the word biopsy, you probably know it means taking a tiny piece of tissue to check for things like cancer. It's a crucial step in figuring out what's going on inside the body, especially when doctors spot something unusual on a scan or during an exam. Biopsies help confirm a diagnosis and guide the next steps in treatment. But what if I told you there's a way to make this process even more precise? That's where pet-guided biopsy comes in. Let's break it down and see why it's such a game changer in the world of diagnostics. PET stands for positron emission tomography. It might sound complicated, but it's actually a powerful tool that's helping doctors see things they couldn't before. It's a special imaging technique that helps doctors see inside your body, highlighting areas where cells might be growing abnormally. These scans are especially useful for detecting cancer because cancer cells behave differently from normal cells. Think of it like a superpowered flashlight that points out the exact spot where something might be wrong. Instead of searching in the dark, doctors can zero in on the most suspicious areas with confidence. In the past, biopsies were often done with guidance from CT scans or ultrasounds. These methods are still very useful, but they have their limitations, especially when it comes to finding very small or hidden abnormalities. But sometimes, those images just don't give us enough detail. Tumors can be tiny, or they might blend in with normal tissue, making them hard to spot. That's especially true for very small or tricky-to-reach spots. In some cases, doctors might even miss the abnormal area entirely, leading to inconclusive results and the need for repeat procedures. PET scans, on the other hand, light up the areas that are most suspicious, so doctors know exactly where to aim. Here's how it works, step by step. First, you get a tiny amount of a safe radioactive sugar injected into your body. This sugar acts as a tracer, traveling through your bloodstream to all the cells in your body. Cancer cells love sugar, so they gobble it up and start glowing on the PET scan. The brighter the spot, the more active the cells are, which helps doctors pinpoint the exact location of the problem. Then, using real-time imaging, the doctor guides the biopsy needle straight to the brightest, most active spot. This real-time feedback means the doctor can adjust the needle's position as needed, ensuring the sample comes from the right place. This means you get the most accurate sample possible, and there's less guesswork involved. Why does this matter? Because getting a clear answer quickly can make a huge difference in your care. Well, getting the right diagnosis on the first try can save time, money, and unnecessary stress. It can also help avoid repeat procedures, which can be uncomfortable and anxiety-provoking for patients. It also helps doctors plan the best treatment for you right away. With a precise diagnosis, your medical team can tailor your treatment plan to your specific needs, improving your chances for a successful outcome. And because PET-guided biopsy is so targeted, there's usually less damage to healthy tissue. This means fewer side effects, a quicker recovery, and a lower risk of complications. Of course, like any medical procedure, it's not for everyone. Your doctor will consider your unique situation, the location of the abnormality, and your overall health before recommending this approach. But for many patients, especially those with hard-to-find tumors, this technology can be a game changer. It's opening new doors for people who might not have had good options before. So next time you hear about PET scans or biopsies, you'll know just how powerful they can be together. This combination is helping doctors solve medical mysteries faster and more accurately than ever. Medicine is moving fast, and with tools like PET-guided biopsy, we're getting better at finding and fighting disease every day. The future of diagnosis is bright, and innovations like this are making healthcare safer and more effective for everyone. Thanks for watching. Stay curious, stay healthy, and remember, understanding your options is the first step to taking charge of your health.